ticking time bomb. That's how a report published on Tuesday by Human Rights Watch and Johns Hopkins University describes the converging crisis of Venezuela's collapsing healthcare system and the rampant coronavirus pandemic.
Doctors around the world are
Last year, the organization had already denounced the deteriorating conditions in hospitals across the country. Many are without access to running water, and shortages of even basic medicine are commonplace.
Venezuela llega a 1,121 casos.
The Venezuelan government has so far confirmed just over 1,000 cases of coronavirus and 10 deaths, numbers the researchers say are impossible to believe.
The Venezuelan government data is absurd. In a country where doctors don't even have water to wash their hands, the healthcare system is totally collapsed, people are overcrowded in poor neighbourhoods and prisons, and authorities harass and chase journalists, doctors and nurses who are trying to inform people.
Doctors interviewed for the report described their working conditions and the plights of patients as deplorable.
Patients are asked to bring the water for admission, which means that for the most vulnerable and poor, that becomes a huge obstacle for admission to the hospital. They have to bring 25 liters of water, which is really quite expensive. The water that they're asked to bring is not only for their own consumption, but even to flush the toilets. In some cases, the situation is so dire that patients are being told to defecate and urinate outside the hospital in the garden, which creates a huge focus of contamination. One of the doctors, desperate to be able to wash his hands before a procedure, had to use the water that was dripping from air conditioners.
Years of economic and political turmoil have led millions of Venezuelans to seek refuge elsewhere. More than 5 million have fled in the past 6 years. Thousands are now going back as the pandemic ravages the economies of receiving countries, but to a future that may be even worse. Alessandro Rampietti, Al Jazeera.